Thank you, Dr. Fowler and Dr. Wong, for being here with us today. We are so interested in all the information that you have to share with us. So the first question we have for you is if you could please tell us a little bit about your organization as well as the work you're doing in Alzheimer's research. And to facilitate that, I'll go ahead and share my screen.
Great. Thank you so much. I'm really happy to be here today to talk with both of you and to everybody who's able to join us by watching this video. I'm Dr. Nicole Fowler. I'm the Associate Director of the Indiana University Center for Aging Research and also an Associate Professor of Medicine at IU School of Medicine. I want to tell you a little bit about the Center for Aging Research. So the Center for Aging Research has been in Indiana for close to 23 years. We are affiliated with both IU School of Medicine and the Regan Street Institute and do a variety of different areas of research for around older adults, issues that are important to them and the people who care for them, whether they be family or medical professionals. The vision of our work is that it's incredibly applied in the sense that we do work that is considered very close to the interests and the needs of older adults in our area and a host of different areas. Of course, around cognitive aging, prevention of cognitive decline, Alzheimer's disease, and caregiving research, but also other areas such as work around delirium, nursing home research, and some other types of work as well. And I wanted to kind of share this slide because I think sometimes when we hear the word research, we oftentimes think of things such as test tubes or microscopes or sometimes even mice or blood draws. And while that certainly represents some of the research that happens at Indiana University, I wanted to draw your attention to the two pictures you see of older adults both on their computer and on their phone, because a majority of the research that the IU Center of Aging Research does is specifically talking with you. It's talking with you over the phone, it's talking with you on the computer, sometimes it's you filling some surveys and forms out on your own. So it's a very different type of research than maybe you might experience in some other places. Next slide, please. Thank you. And as I mentioned, our mission is to improve the healthcare and self-care of older adults through research. For the past 23 years, it's been our vision to become the nation's leader in academic research, focusing specifically on the health and well-being of older adults and those who care for them. Next slide, please. And lastly, an example, as I mentioned, the applied work that we do, we're really ensuring that the things that we do from a research standpoint is to grow the science and develop new things that work for older adults and who care for them, but also to make sure that it gets put into the care system. We do research not for the sake of it, but to improve the patient experience and the experience that those people have who care for them in the healthcare setting. And the work originates specifically, as I mentioned, from the needs of older adults. And thinking about also the environment for older adults, where they get their care. Sometimes it may be research related to hospital systems or nursing homes or in your primary care setting. Next slide, please. And I'll pass it over to Dr. Wong.
Well, I want to first of all thank you so much for having me here today. So I'm Dr. Sophia Wong. I'm a physician and I function as the outreach, recruitment, and core leader for the Indiana Alzheimer's Disease Research Center. So just to share with you a little bit more about the Indiana Alzheimer's Disease Research Center, we're one of 31 centers that is funded by the National Institute on Aging. So basically what that means is that it's a very competitive process to become one of these centers. And we are part of a greater mission serving not only Indiana, but also the nation and even internationally to help find a cure for Alzheimer's disease. And the underlying philosophy of our center is that Alzheimer's disease is so highly complex. And as Dr. Fowler mentioned, there is the healthcare system, but our center actually has a wide range of both scientists, researchers, and clinicians like myself. So it goes from everything from the biological to looking at people's behavior, physical environment, the social and cultural. I have to tell them, well, right now there is no cure. And we want to be able to change that. part of our goal of our research is to find a cure for everyone. But then there's a second part to this that many patients, particularly those who are African American and Hispanic, ask me, and that is, how do you know this treatment is going to work in me? You know, because a lot of our underrepresented minorities often see that for hypertension and diabetes, medications, which have been shown to work in other populations, don't work in them. And that brings us to our another underlying philosophy, and that is we're working towards what we call precision medicine. And so what we do is we take that really wide spectrum that we have here, going all the way from the biological to the healthcare system, is we really use our biological knowledge to be able to figure out what medication, what drug is going to work for you. What is the different mechanisms that's causing you to have a memory problem? And one day, our ultimate hope of our research is that when my patients come into my office, I'll say, we have a cure for you, and we have a cure that we know will work for you. We're not just taking a chance on our medication. And that's the ultimate idea behind our center. And we have a number of really exciting studies going on in our center. A lot of these are national and even international projects. This is just really a small number of studies here. So we have Model AD, which is being run in collaboration with the Stark Institutes, in which you're developing innovative, groundbreaking models to help try out a bunch of medications and mechanisms in animal models. But we also are looking at people as well. People is very important to us. That's the heart of our work. It's clinical research. And we're looking at, for example, you know, in the second picture we see here, we look at functional neuroimaging. So how to say, for example, do social networks, the number of friends you have, the number of family member connections you have, how does that affect your emotions? How does that affect your ability to think? And most importantly, do changes in these affect your ability to, say, either prevent dementia or show signs of dementia? And the other thing is part of our theme of finding a cure for everyone. We often traditionally think of Alzheimer's disease and other dementias as people who are 65 and older. But we know that a lot of early onset cases for people under 65 are going under-recognized. And part of our national study is LEADS, which is the Longitudinal Early Onset Alzheimer's Disease Study. That's led by Dr. Liana Apostolova. And I'm proud to say that Alzheimer's Association is also helping to fund some of our work as well. And what we're trying to do is to find both genetic and environmental causes that are leading to some people to develop this disease at a much younger age and tragically affecting both their families and caregivers. And then we use that information and then we can apply it to people who are, say, 65 and over. So it's really about being able to share that information. But I think the last and probably the most important thing is we do not see our people who join our research studies as data points. They're people that we value and we respect. And our main goal of our center is to foster a dialogue between the community and our researchers, whether they're physicians or scientists. And part of our work is, and we'll mention that a little bit more, is we have a wonderful community advisory board here. And I really encourage you to check out our Facebook video. But we are trying to work with the community to talk to them about our research, getting their feedback about their research. And here we have a really wonderful conference video between Harolyn, one of our CAB members, and Dr. Tatiana Farad, who leads our genetics and biomarker core, is now the Associate Dean of Research here at IU School of Medicine. So that is also, more importantly, what we're trying to do, is that we not only are the umbrella for a large number of national and international studies, but we more importantly want to make sure that the people who are interested in our studies really want to have a dialogue with our center. So thank you so much. Why don't we move on?
So much, Dr. Wong, and I just got to say, it is truly a blessing to be a part of this panel with you two. It's great that we have two inspiring women in the research field. I am in love with that. And this next question I have is really timely. I mean, you can't go anywhere in our current environment without bringing up COVID-19. It's a buzzword. It's happening. It's present in our lives. And I am for certain that there is COVID-19 involved in research, and it's probably having some level of impact. I want both of you to answer this question because I'm sure you have different things that are happening at both of your centers and organizations, but I'm going to kick it off with Dr. Wong first. How has COVID-19 impacted research within your organization in terms of changes that you've had to make, maybe improvements, or a bigger thing, obstacles?
Well, there's no question that COVID-19 has affected our research studies, at many different levels, both locally and nationally. The most important thing is that we want our research participants to trust us. And the key to maintaining their trust is to making sure that they feel safe and secure when they come do our research studies. Now, as much as possible, we have moved our research infrastructure to be done remotely safely, but some of these, do require, like the scans and things that can't be done, at home. So we've taken extensive measures, and those have to be approved by both the IRB, which ensures participant safety, and our went through the IU, research, infrastructure again to ensure safety of both the participants and the staff. So there's extensive cleaning measures, and we're happy for those who have more detailed questions, certainly reach out to us. So there is that impact. But the second impact that I think is even more important is that we are looking at how COVID-19 is affecting people's mental health. And we're also going to be starting to look at mechanisms. There's been a lot of talk in the media. I'm sure that people have seen that COVID-19 increases the risk of delirium. We know that delirium is a risk factor for dementia. So just to back up for everyone, delirium is actually when someone gets acutely confused in the hospital, either due to a sudden medical illness, which can be due to COVID-19 or surgery. So that's an area of interest of mine. We're going to be looking at that both at a local and national level. But one of our current studies right now is looking at, mental health effects and how it's affecting people's social networks, especially in older folks' inability to get out. So yes, COVID-19 is affecting us, but we are moving forward. Our studies are being done safely as possible. We always value our participants, and we are also taking strong action in terms of doing research to understand the full effects of COVID-19 and what we can do to help older adults and even begin to understand the mechanisms so we can actually prevent, hopefully, future cognitive decline in dementia.
Dr. Fowler, anything else to add? I know there are probably some other improvements that your center has made given COVID-19.
Yeah, absolutely. I think that, additionally, as Dr. Wong said, we are being part of IU School of Medicine. We have certain precautions in place to ensure both the safety of our participants and also our staff who are working on the research projects. I think one of the things that I'll add is that we've been really lucky at the Center for Aging Research in the sense that we've always sort of thought about the participant as a partner in the research process. So thinking through things that are really convenient and make sense with them, especially our caregivers who we know are incredibly busy and have a lot of other responsibilities. So we've been doing things remotely, telephone and video for a while. And so when COVID and the lockdown required us to kind of change up, some of our studies had very little change involved because we were already working with caregivers and people over the phone. But I will say, I think one of the things that's been a benefit, if we can talk about some of the positive things that happened with COVID in the research process, is it's really had us think through and talk with our participants about what makes the most sense for them and for what they're comfortable with, and also to be really innovative. I think we have found that some of the folks that we work with have started to use technology like Zoom that they haven't used before, and now they want to. We used to talk with them by phone, and now they say, well, can we do it by video? I'd love to be able to see you when we talk. And so that's actually been a really additional benefit of the work that we do. And we also, of course, are really concerned about mental health of the community as a result of COVID, and have been studying things like social isolation and loneliness and late life depression for years, and now have pivoted to kind of think, what's the overlying addition of maybe a cognitive decline in addition to social isolation, and how are those two maybe working together in a way that's increasing someone's cognitive decline. So we're focusing specifically on how COVID could be impacting people's cognition, and also the unintended consequences. I mean, obviously we know that COVID disproportionately impacts older adults as a virus, But what we haven't spent a lot of time thinking about, I think, as a community that we're focused on, is how is it impacting people in an unintended way? You know, how many older adults maybe aren't being able to go to see their physician the way that they normally would, or they're delaying a surgery that's they had planned that might improve their functional status, like a hip replacement or a knee replacement, or how is it impacting their ability to just see specialists for some of the other conditions that they have. So we're really kind of thinking widely about what the unintended consequences are, both for people who live in the community and of course those who live in nursing homes who have had an unfortunate inability to see their loved ones over these past few months.
This is such great information because we know research is so important, but for many people, research kind of comes with hesitation, right? So some people don't know enough about research, which is why we're here today. But other people have fears circulating around research, and they really don't understand either what the purpose of it is or how they can get involved. So my question to you both is, what would you say to someone who is hesitant about joining a research study? Why should they even get involved in research? What's the point?
So I can take that first and then pass it off to my colleague. So I think you're right, and that was actually the point of one of my slides where I showed the different pictures of maybe what people think about when they think about research. I think we might see things on the news, sort of people in the lab putting sort of liquid in the test tubes or blood draws or something that feels kind of invasive. And while some people have a reaction to that and others don't, there is sort of not a one-size-fits-all when it comes to research. I think that everybody has an opportunity to participate in a level that's comfortable for them. I mean, some people are really interested in finding sort of cutting-edge, medicines and devices, and that's really important participation. And that doesn't work for everybody. And sometimes people are not interested in that, but they still want to help their community and be able to help, say, other caregivers or other persons with cognitive decline. So maybe answering survey questions over the phone is something that you feel comfortable with and you're still participating. So I think the message is that there is something for everybody when it comes to participating in research, especially at an institution like Indiana University that has so many different offerings along that entire spectrum of research, everything from very basic science all the way through to understanding communities and social networks.
Well, Hadia, that is a really important question, and it's one that we constantly deal with. And I'm really actually proud to say here that Hadia is actually part of our community advisory board for our center, because this is where I think a lot of humility is needed from the researchers. We actually don't fully understand why people in the community aren't comfortable with research. It could be a lack of knowledge, but it is a lot of it's, lack of trust. And we need to begin to understand why. And what we have done actually is that we have just started we're going to be soon starting a research study that got funded to look at these questions, particularly in people who are more vulnerable to developing dementia, that is, African Americans, underrepresented groups such as rural residents, because this is really a crucial issue and it's one that we should not be ignoring. So if people are hesitant, actually, my answer is now there's actually a study that we are putting out there to let people voice those concerns and for us to listen to their stories and begin to understand how we as researchers need to adjust our approach. Part of it is the anxiety of, yes, will I be prodded and poked? But I think it's a little bit deeper than that. I think it's also, frankly, a mistrust that we've seen between the healthcare community and a lot of these very vulnerable groups. So I think it's a really complex question. And I think the most important thing is that's our ultimate goal as a center, is to begin to foster that dialogue between the community and the research community, so that way we can begin to actually know what the answer is, then rather than pretend to know what the answer is, because we don't know yet, but we want to find out so we can help everyone. So.
Thank you for both of your responses. And hearing you talk about that, it truly does sound like there is a study for anyone and everyone. There is always some way that you can get involved, even if it's just to provide your feedback on how you view research. And that kind of leads into my next question here, which is something that we get asked about quite often when it comes to discussing research with our communities is, do I need a diagnosis of Alzheimer's or dementia to take part in an Alzheimer's or dementia study? That kind of seems like it's a given, but I think it's a part of a larger question of what does eligibility look like? How does someone know if they're eligible for a study, and do you actually need a diagnosis for that? I'm going to let you guys kind of answer that one. Maybe Dr. Wong, if you want to kick us off.
So I think that question is a very crucial one because studies come and go. And I think one of the things that we have found in our work with the communities over the years is that it gets confusing because the eligibility criteria changes for every study. And then it's this constant sort of keeping up with the news. So the way our center approaches recruitment is that our goal is to form all those studies we showed, and there's tons of others, is that we form a central hub. And what we do is when people contact us, we take their information down and then we look at all our studies and see what they're eligible for. One of the key issues that we are, lots of people are running into is that the same people keep on getting approached again and again and again. And that's not a good experience for either the person trying to participate or vice versa. So when you pick up the phone or you drop us an email and talk to us, the first thing we just want to do is to get to know you as a person and know what you want. No, you don't need a diagnosis. We will work with you. We have people who have no cognitive concerns. We have people who have what we call mild cognitive impairment, that is cognitive changes without any functional changes. That is, they're still able to get through life. So maybe things aren't going quite as smoothly as they want, but they're doing well. And then we have people who have actually what our clinical symptoms consistent with early stage, Alzheimer's. Having said that, one of the wonderful things about having our center well embedded with so many clinicians is that if our research participants are also interested in clinical care, is that we can easily get them connected. And that's actually one of our major goals. Is sometimes people call and they actually turns out they don't want to do research. They just want help, which is fine. We get them set up as well. So we try to meet people where they are. I tell folks, don't worry about the eligibility criteria. Just call us and get to know us and stay in touch with us on the latest information, because that's our goal, is to foster that, once again, that dialogue between the community and our center in an ongoing fashion for many years to come.
And I would echo that it's confusing sometimes for participants, but it really, every study does have its own unique goals. It has its own unique setting and things that they're looking at, the types of research questions. And so there are different eligibility criteria for studies. And we do try really hard, as Dr. Wong mentioned, to ensure that people aren't approached for multiple things and that we do a really good job of matching what they're interested in. So sometimes it's a conversation about what they're interested in learning about and participating in and what we have available. And then every study does have a set of criteria that they'll ask participants a series of questions to find out if they're eligible. And if not, then we have a host of others that we can refer them to or have somebody give them a call. So it really is individualized. And sometimes depending on what the study is, somebody may have a diagnosis. Other times they don't. Lots of the studies that we do in particular, people self-identify and say, yeah, I'm a caregiver for somebody who has Alzheimer's or dementia. And that's the criteria that we use.
Now, I know you have some very important information to share with us about different studies that are happening and information about your organizations. So I'll go ahead and share my screen once again to facilitate that part of the conversation. And Dr. Fowler, if you could start us off by giving us some more information.
Sure. I actually, I wanted to highlight two studies today, really because they mesh with one of the questions that we were asked, which is how have your centers and your studies adapted to COVID? And so actually two of these studies I'm going to highlight are able to be done 100% remote in the comfort of people's own homes. And the first is the DECADE study. We at the Center for Aging Research, as I mentioned, are really interested in understanding the experience that people have as a caregiver in the healthcare system, and we know that medical decisions are a crucial part of that experience. They're making decisions for or with or on behalf of their loved one. And we're specifically trying to understand how can we help caregivers of older women make medical decisions. And the Decade study is one of those in particular, where we're testing some educational material for caregivers regarding medical decisions. And we're enrolling dyads, so a caregiver and an older woman with Alzheimer's disease or related dementia throughout the state. And all of the interactions are able to be over the phone. And so it's about a 15-month long study, and we work with the caregiver in particular, and if the older adult themselves wants to also participate, they're welcome to participate as well. So that's the Decade study. And then the next one is In Peace. And In Peace is one of the studies that we're working with caregivers again and older adults with Alzheimer's disease. And it's specifically looking at problems regarding symptoms. And so helping caregivers identify and think through symptoms that that person who they're caring for may have. And this actually is a 2-year study where, once again, everything is able to be done over the phone. And all of the participants will get some educational materials, and some will have some additional visits by a care coordinator. So I have some information at the end for people to get some more information. I know we don't have time to go through all of the eligibility criteria, but there's some numbers at the end where people can make a phone call or send an email to get some more information. This is for the Decade study. It'll be Eleanor, and then Laura for In Peace.
And Dr. Wong, we'll segue to you.
Well, so I think where I want to end is where we began, by just, the dialogue piece. And we have, we have so many research studies. I think I could probably just spend a whole hour talking about all of them. But I think the most important thing is there are so many ways to get involved in research. On the left here, and this was before I joined, but we have the Community Advisory Board who gives us feedback on our research and, issues that come up with our research participants. Some of the people on the Community Advisory Board, they're research participants, but a lot of them are not. But they're still happy to contribute to the research mission in their own way, whether it's making other people aware of what our center is doing, or participating in like those video dialogues that we have with, Harlan and Dr. Farad. I think the other important thing is really come join us, email us, sign up for our newsletter, join us on Facebook. We know that research is important, but we also want to meet the needs of everyone else. We know, for example, that a lot of people don't have access to their doctors. And so we're starting a Ask the Doc every month. We encourage people to submit questions, not only about research, but ideas they could have about research, but also just questions that they have as well. So again, research is very, very important, but most importantly, we want to have a dialogue with you about the questions that really are affecting not only our research participants, but the community. Because we think the best way to convince people that research is important is to foster a dialogue between the community and our center. So please, give us a call, email us, follow us on Facebook, ask us a question. And I want to thank you again for that. The other thing I wanted to move on to is, I think the other really important part is that every year we have an annual Caregiver Symposium. And I think this year, especially given what we've seen with COVID, I talked about diversity being a really major hallmark of our center, but we also are struggling with the issue of disparity. And I think we really saw that with particularly nursing home residents being affected. And so this year's theme is we've invited two really nationally, and in this case, also internationally guest speakers, Dr. Crystal Glover from Rush. They have their own Alzheimer's Disease Research Center. So someone from our sister center, as well as Dr. Carl Hill. So this is where we sort of have to say we're very proud of our relationship with the Alzheimer's Association. He is the Vice President for Scientific Engagement at the National Alzheimer's Association office. So please join us for their talks, and at the end it's a 30-minute forum. So once again, our goal is to listen to your voices and for you to share with us, you know, what you think research should be answering and what we can do better as researchers to answer those questions and help each one of you and hopefully help you feel inspired to also join our research mission and help in your own way. So registration is available on our Facebook. You can also email us or call us at the numbers and email listed there. So thank you again.
Thank you both so much for kind of highlighting some of those opportunities that are coming up or ways to get plugged into the research field. We know that people ask us often, what can I do? How can I get involved? What is available there for me? So I hope that in viewing some of those opportunities or ways to get involved, something spoke to you, or maybe not you specifically, but maybe a family member or a friend that you think might really be interested in something like that. And if any of those contact information pieces are necessary for you, feel free to go back and pause the video, write down the information you need, or get in touch with us and we can expand on any of those topics prior. One last thing I wanted to mention was our Alzheimer's Association Trial Match service. This is right in line with ways to get involved and ways to learn about other studies, not only in Indiana, but there are some studies that are happening all over the nation and ones that you can participate in it as well. Our two panelists today mentioned that phone options for interviews are definitely happening with COVID-19 playing a factor. So now is the time to get involved in research from the comfort of your own home. Trial Match, as the slide says, is a free service. It's easy to use. You plug in your information, your demographics, and Trial Match will match you to some clinical trials happening in your area that you might be eligible for. And once you look at the studies, you can follow the page and learn how to get plugged in and how to enroll. You can also reach out to our helpline number and they can kind of set this up for you too. The database of studies is continually updated. We have new research coming out all the time with over 400 clinical studies. And we have both drug studies and behavioral studies. So if the test tubes, if the blood draws are not really your cup of tea, it might be exciting for some and others maybe not so much. We do have behavioral studies that you can play a really large impact in how to greatly and positively impact healthcare policies moving forward and how communities interact within this space.
And Riley, if I could just follow up with the information that you're providing, I do want to let everyone know that research should never charge you. You should never have to pay to participate in a research study. You should never be solicited to provide any source of income, anything into a research study. So it's important to be aware of that. And the reason that Trial Match is so important is that it's important to find studies that are reputable, to find studies that are peer-reviewed and that are ethical. And so this facilitates that for you all because we do the heavy lifting of making sure these studies are valid and legitimate. And I also wanted to share at the end that for researchers, if your studies are not listed on clinicaltrials.gov, you're also able to visit the Trial Match website and submit a request to list your study, and we will go ahead and make sure that it meets the standards to be listed on Trial Match. I just wanted to add that before we move forward.
Absolutely. And another thing that every research study should have is a consent process. You should always be well informed about what you are to expect going into the study and what you can imagine will take place. And the assistant or researcher that is having those conversations with you, don't hesitate to ask those questions. Don't hesitate to advocate for yourself and really have a good picture of what's going to happen for you in that research study. They don't want it to be a scary process. They want you to be well informed. They want you to fully expect what is coming. So every study should have that as well, and you should expect that too. These are some of the ways to get your Trial Match profile set up. If you would like to pause the screen on the video and record these steps, You go to our website, you complete a questionnaire, and like I mentioned prior, it will match you to a service. Next, Hattie is going to talk a little bit about something that you could get involved in today as it relates to research.
What Riley is referring to is our Alzheimer's Association International Conference, which fortunately for us, we were able to host virtually this year, and is and was completely free to any and everyone who would like to get involved. In order to learn, we held the conference, but the great thing is that we were able to record all of the sessions, and we are still providing all of that information. So if you missed it or you didn't know about it, you still have access to all of the great research that was presented at AAIC. This is where we convene researchers from all around the world, so we can learn about the many, many studies that are happening in research. As Dr. Wong and Dr. Fowler mentioned, there is so much diversity in the information that's being studied in Alzheimer's research, and you really want to make sure that you're informed about what's going on. And so in order to learn more about AAIC, feel free to visit the website that is listed on the screen. Feel free to register. We will still be having, videos will still be available until the end of the month. And we encourage you to continue getting involved in research. And I'll share a little bit more about how you can learn more. If you have any kind of smartphone, you can download an app called the Science Hub. And this is where research lives on a day-to-day basis. You can have research at your fingertips simply by downloading this app. And every morning I wake up and I check this app. It's become my new form of social media because I'm really interested on what's happening in the research field in Alzheimer's. And because things are changing every single day, you want to keep up to date. And the great thing about the Science Hub is that there's information for everyone. I was like, am I smart enough to learn about all this research? And believe me, if I can understand the information, surely you can too. So I highly encourage you to visit this if you'd like to learn more about research. And we want to end by saying a big, big thank you to Dr. Fowler and Dr. Wong. We so appreciate you being here with us today. This has been such a good discussion. We want to encourage everyone to really listen in. Feel free to go back on the parts that you didn't understand. Visit their websites, learn more, call them if you need information. And remember, if you need any support from us at all, we're still available. You can call our 24/7 helpline. You can visit our support groups, our education programs. And Riley is actually going to share a little bit of information about some events that we've got coming up.
Yes, and I echo entirely what Hattie has said to just thank our panelists today. We'll let them kind of close out a little bit, but before I just want to plug, next Friday we would typically have another Facebook Live session, but in place of that, we are doing something really exciting called a Day of Learning. This is an opportunity where all of our events on one day will be on one Zoom meeting for the entire day, from 8:30 in the morning to 5 o'clock at night. You can tune in to multiple different opportunities to get updates, have education, and learn stories from our caregivers and those who we help and support every day in support of our mission. We also have an exciting update. In the afternoon at 3:30, we will have a 1 CEU credit for the School of Social Work. So if you are interested in receiving that CEU credit, please go on to our community resource finder. We can throw the links in the chat after this video, and you can also call our 24/7 helpline. This event is a la carte, so even if there's only one event that you want to see that day, still register because you will have access to the whole day, and we will send a more detailed schedule upon your registration. So don't want to miss on that. It's our first ever Day of Learning. We're very excited to do it virtually. We're feeling out this whole virtual environment. We hope you are too. So I can't wait to see you guys on that. But I am so thankful that you guys were willing to jump on with us today. We had some technical issues, couldn't go live, but we recorded the session. So thankful for that.
Thank you for having me. I was really grateful that I could be on and talk a little bit about the work that we're doing and hear about all the amazing things that the chapter is doing, and excited that we continue to partner on projects throughout the region. So thank you.
Well, again, I want to thank both of you. I can't say what a great pleasure it is to be continuing this relationship. So we're so excited that Dr. Carl Hill is going to come speak virtually, albeit with our Caregiver Symposium. And then I think we also forgot to mention that in think somewhere late November, early December, we'll be working with the Alzheimer's Association to have a special Q&A dedicated to caregivers dealing with holidays, because I think it's always a relevant issue, but I think this year more relevant than ever. So please either email our center or email the Alzheimer's Association Center. We just want to make sure we keep on listening to your concerns, and whether they're research or clinical, we want to be here for you in partnership with the Alzheimer's Association. So thank you again for having us.
Thank you both.
Yes, thank you everyone. Hope you enjoyed the video, and if you found a certain part of it exciting or interesting or shocking, let us know in the comments. Like, we answered a lot of questions today, so we're excited to hear your feedback. But until next time, bye.